All right, we're recording. So again, welcome to the open enrollment period for 2017-2018 benefits. All of the benefits that we're going to talk about today will be effective November 1st, and they'll go through October 31st of next year, 2018. So that means that October 31st of this year, every benefit that you have may possibly term, depending on if you re-enroll. So what I'd like to do to start off is introduce, first of all, Jim Blakey from Caddo & Caddo. Jim is going to present the new benefits for the year. If you have any questions, again, we're here for you. Go ahead and raise your hand, ask some questions. And Jim, welcome aboard.
All right, good to be here. Afternoon, everybody. I'm sure everybody's had a big lunch and would like to take a short nap right now, but I hope you won't. I'll try to be brief and get us through this afternoon session. There's a booklet that everybody has, I think, in front of you. This is an enrollment guide that our firm puts together to kind of help everybody here at APA understand what their benefits are. It gives them a reference book to go to. It has your contributions for the various and sundry products that are available. And so might be a good guide to hang on to just in case you need it sometime in the future. This is, as Delia said, the open enrollment period, which means that we have a time to enroll in benefits that maybe you don't have, or to make changes in those that you do. And it really is the one time a year that you get to do that, unless there's some extraordinary, things that happen concerning family status or insurance status. And so, and we'll talk a little bit about that in a minute. The nice thing about this year's open enrollment is there's not significant changes to what we currently have in place. So the things that I'll be talking about, which are effective November 1, are going to be fairly modest. We're staying with Blue Cross, same health plan that we've had all along. So not much worry about providers changing. The benefits themselves have not changed. Slight increase in premium, but really pretty nominal. So I don't think you'll be too upset by that. We are changing the dental carrier because of a fairly significant rate increase we got previous. But the plan that we're moving to is actually a little bit better than the one you have right now. So I think that'll be a positive as well. And then pretty much everything else remains the same. You all have a really broad base of benefits. It's a good program. APA does a wonderful job of contributing a lot to the plans that they contribute to that aren't really voluntary. So you really have a really nice program. This booklet, first page, really talks about what I do to get going. Click. I'll just push down.
Just click and then.
Sorry.
It's okay.
There we go. Okay. So first page is blank. Exactly. Second page just kind of gives you a schematic of what things are paid for by the employer, what by you, and which was shared. And the ones that are shared really are the medical and the dental. Down below is the eligibility and also those events that can occur. And, I just remembered I did not really go over these in the first meeting, but they haven't changed any. There are occasions in which you can make changes other than at open enrollment, and they would involve something like getting married, getting a divorce, having a child, having some insurance coverage that changes. So, for example, if my wife had dental coverage, so I wasn't covering her on this plan, but then she got a job where she didn't have dental coverage, then that would permit me to add her to my plan during the year. Those are the kinds of things that would allow you to make a mid-year change. Otherwise, after we close open enrollment, whatever you've selected is what you're going to have until the next open enrollment. Okay, so then we move into the medical, and the medical really is obviously the biggest driver of benefits for most people. It's where the greatest cost is. It's where your greatest liability comes up if you do have something that happens to you. And we are continuing on with Blue Cross, as I said, and there's no change in the plan. You still have the same $40 copay you have currently for doctor visits, and that's really a pretty good feature. Virtually every other insurance company now has a split copay, so that you have a one copay for the primary care doctors and then a much higher copay for specialists. Blue Cross, or at least your Blue Cross plan, still has the same copay for either one. So that's a good thing. The copay also covers things like lab work and x-rays. So if you go to the doctor says you need a little lab work done, or you need an x-ray done, your copay is really all you have to pay, even though you may go to another facility to have those other services performed. The exception to that is if you have to go get an MRI or a PET scan or a CAT scan. Those are expensive, imagings, and those are subject to deductible. They're not covered under the copay. Okay. The plan has a large deductible, and so at a high level, let me explain what we're doing here. Most of you, I recognize some faces, have been here, so you understand this. But for those that don't, or for those who have forgotten, we actually buy an insurance contract from Blue Cross that has a $5,000 deductible to it. And the deductible applies to hospital visits, outpatient surgery, these expensive imagings that I was mentioning earlier. And so if you have one of those, then Blue Cross is only going to pay the amount that exceeds $5,000 during the course of a year. Okay. So if you go for outpatient surgery and you spend, I don't know, $2,800 for the services that you get, that really is not covered by your insurance policy. It is, but it is subject to your deductible. And since the deductible is $5,000, then it becomes all your responsibility. But what we've done at APA is they have incorporated a health reimbursement account. And this health reimbursement account reimburses you all of your expenses under that $5,000 deductible and that $5,000 out-of-pocket maximum that you have, down to where you only have $1,000 out of pocket. Okay. So when the dust settles, oops, sorry about that. Did that wake everybody up? So when the dust settles, the maximum you would have to pay out of pocket is going to be $1,000 per calendar year, with some limited exceptions, which I'll talk about in just a little bit, having to do with copays and some of the prescriptions. So it's a little more complicated, because what you have to do is get your claim processed from Blue Cross, then get a copy of your explanation of benefits, or we call an EOB, and then send that to SBS, which is the administrator of the health reimbursement account. And then they will issue, do they issue the check? They already all do issue the check. SBS issues the check back to you as a reimbursement, okay? So a little more complicated, but what we found is by buying the larger deductible, it helps keep the cost down on our insurance contract, okay? Any question on how that works at all? Anybody had experience with it? Okay, and it worked effectively for you? Okay, good. Okay, so a couple of other areas that I might mention is the difference between emergency room and urgent care. You probably have noticed there's what looks like an urgent care on just about every corner in San Antonio. These are these freestanding emergency rooms. The cost of those is considerably higher than what the normal urgent care services are. And so we have a copay of $60 if you go into an urgent care center like Texas Med Clinic. But if you go into one of these freestanding emergency rooms, you're going to have a $100 copay, plus it's subject to the deductible. It's a lot more expensive than if you go to the urgent care center. So I told the group this morning the thing to do is figure out where the closest urgent care center is, where you want to go if something does come up unexpectedly, minor emergency, after hours, whatever, so that you don't accidentally wind up in an emergency room when you don't really need one, because it is going to be a lot more costly. Okay. The other thing that we can talk about a little bit is the prescription drug program. It did not change. We still have the $20 copay for generics, $40 for preferred brands, and then $60 for non-preferred brand names, which typically are the more expensive drugs. The one thing you have to watch for, and Liza pointed it out earlier this morning, is that the insurance companies change their prescription drug lists, called it PDL, every year a little bit. They tweak it. It's not a wholesale change, but you may have, out of the hundreds of drugs they may have 25 or 30 of them that'll change copays. So you might be on a drug right now that's a $40 copay, and if you check with a pharmacist, they may tell you, well, it's going to $60. Well, might be a good idea to discuss with your physician whether or not there might be another drug you could take with a lower copay, okay? Or it may go the other way. It could be you're spending 60 for it, and it may actually go down because it does go both ways. So there can be some changes in the copays on drugs that you're taking. So if you're taking something on a maintenance basis, I would check that. The other thing to remember.
I'm sorry.
Sure,
I'll
go
just
ahead.
add that if you're not sure what your
Yep.
tier is, there is a drug list uploaded in the HR and payroll folder on the internet. And so that way you can search for your drug and then you'll know which tier it's on. So just so you know it's there for your reference.
That's a good point. Good point. Okay, the other thing that I want to mention about the drugs is we have a program that calls for you to, it's called mandatory generics, so that if there is a generic drug that's competing with a brand name, that you are supposed to take it. I mean, you can get the brand name, but if you do, you'll wind up paying a higher copay plus the difference in the drug cost. So let's say there's a generic that's a $20 copay, but yet there's another drug that's brand name, $40, but it might be that it costs $100 a prescription more than what the generic costs, or $200. So you would also pay that difference in the drug cost. The extra copay that you pay for a drug and the extra cost that you pay is not subject to reimbursement under the health reimbursement account, okay? So when I say your limit of expense is $1,000, it generally is, unless you choose to take a brand name drug where there is a generic available, okay? Any question on that? It's a little bit of a, okay, good deal. All right. There is another separate, we have an out-of-pocket maximum under the medical plan, which is $5,600. That deductible comes from your co-insurance, your co-pays for your office visits, and your deductible. But there's also a separate $1,000 maximum out-of-pocket. If you're taking a lot of expensive drugs, let's say you're taking three, highly $60 copay name brand drugs a month, so that's $180 a month. So you'll spend a little over $2,000 a year just in copays. There is a cap of $1,000 on the drug program, so that once you hit $1,000 out of pocket, then the plan pays 100% thereafter. But again, remember, that doesn't count when you're choosing a brand name over a generic where one is available. So that would only be if there's just brand name drugs that you're using that way. Does that make sense? So it's a $1,000 cap, and that way you're not out of pocket anymore. Okay. Let's see. I'm going to flip on to, well, any question on just the basic layout? That's a pretty brief summary. Inside your handout, I think there's something called a summary of benefits and coverage. There's a lot more detail. If you want to know how much it pays for wheelchairs and stuff like that, you can find that in this SBC. Or if you need to know that, I'm going to talk in a minute about a lady named Tina Berger who works with us. And Tina is the account manager for APA. So if you have a question like that and you don't want to spend your afternoon reading the SBC, you can call her and she can generally answer your question about things like that. Anything else? Yes, ma'am.
The prescription drug plan, is it still requiring us to use like Walmart? It used to be CVS and then they changed. Yeah, or Walgreens.
Could somebody use a microphone if they're...
Did I knock it off?
Yeah, you could repeat the question, please.
Okay, the question was, are we required to use Walmart or Walgreens? Walgreens is still a preferred RX vendor. We had a meeting with Blue Cross sometime earlier this week, and they think that as of January 1, CVS will be back in that preferred group of providers as well. But right now it's still Walgreens and Walmart. There's several. HEB's part of it as well, so there's not just one or two. Yeah.
Jim, can you clarify for those employees who have gone through step therapy?
Yep.
Will they need to do
Yep.
that, or
Yep.
how does that work?
Okay, so all these insurance companies have these prescription drug programs that have some drugs that require step therapy, meaning you have to try one drug before they will approve a second or a third one. Some of them have pre-certification required where your doctor has to call and talk to a medical director and explain why a certain drug is needed. And so those of you that have been through that process already, you're not going to have to do it again. I mean, it's just a continuation of where you are today. But if you start something new, it might have that step therapy, or it might have that pre-certification requirement associated with it. But nothing, if you've already done it, then you're good to go as far as the next plan here is concerned. Yeah. Is that the point that
Yes.
we need to make? Okay. Any other questions on the basics? Got a couple of other points on it, talk a little bit about the cost, and then I'm going to just look real quickly at that health reimbursement account again, just to be sure everybody understands that. Okay, so we talked about the mandatory generics. We talked about step therapy, talked about the out-of-pocket limit. So I've pretty much covered all that. This is going to be the deductions that you will have for the Blue Cross plan beginning next year. It's a little higher, or excuse me, in November, next plan year. The current rate is somewhere, I think, around $21 or $22 if you're single, maybe $135 or $36 for a family. So it did go up a little bit, but not as much as we are seeing on a fairly regular basis with an awful lot of our other plans. I mean, 10 or 15% is not uncommon in today's world. So still a pretty good bargain as far as, especially of those of you with dependents. We don't have a lot of companies nowadays that are still contributing significant amounts to dependents, and APA still does that. So that's a real good deal for everybody. Okay, let's see. We talked about the SBCs. You have the SBC, you have that. This is just an app for your phone that if you want to download it, you can create your own account. It has information about doctor lists and things like that. You can look at your EOB, and I guess if you have the ability to print from your phone, you can do that or send it to a printer. You can view your ID card. So, if you go to the doctor's office and they need to see an ID card, you actually have it on your phone and you can just show them. Don't have to carry it around with you. So that's something that, might be of some interest to you. This is the health reimbursement account. We talked about it already, but just to reemphasize, the purpose of the health reimbursement account, again, is to allow us to buy a less expensive insurance policy. Because once we send the money off to Blue Cross, they're not going to send it back to us. So we cut our costs as much as we can, and then we put in the health reimbursement account to bring the benefit back down to where APA wants to have it, and that is to limit your exposure during the course of a year to no more than $1,000, plus that differential between, the generics and the brand names that you choose to buy. So whether it's and that $5,600, or excuse me, the $4,600 reimbursement that APA will reimburse you works to reduce your out-of-pocket on the in-network to $1,000. If you go out of network, they're still going to reimburse the same amount, but your out-of-pocket goes way up. So we hardly have any utilization on out-of-network. When we look at our plans, we have 98 to 99% of the utilization is in-network anyway, so it's really not that big a deal. If you have family, you're capped at $2,000 max out-of-pocket, regardless of the number of family members that you have. Okay, so that's a great program. Again, a little complicated because you have to first get your EOB from Blue Cross and send it into SBS. But at the end of the day, when the dust settles, you got a really great program. The HRA form that you need is on the
intranet. On the HR and payroll folder, all the claim forms that you need to submit a claim, either using the HRA or any other claim form for SBS can also be found on the HR and payroll folder. They're already ready to go.
See Mike O'Toole out in the audience there. I haven't seen him in a while. How you doing, Mike? Okay. All right, next page is really common sense kind of stuff. It talks about where you can get treatment for whatever, and it starts at the emergency room, works down to the doctor, and emergency room obviously is the most expensive place, and then the freestanding ERs and urgent care and so forth. And I just told the group this morning that I think if I felt like I needed to go to an emergency room, I probably wouldn't go to a freestanding emergency room. I'd probably find my way to the hospital. If it's that bad, I think that's where I would want to be. But
Is it easy to tell the difference down there, whether you're, or are they trying to scam you a little bit by making you think
there's
it's
a lot-
urgent care?
Yep, a lot of scams going on, Mike. They are required by law to have emergency somewhere on the building they're in. And I think most of them, if not all of them, do. But, you know, when you're in a hurry, when you're not really paying attention, and it's on one side of the building and you pull up on the other, sometimes you just don't see it.
Right.
So I've suggested to everybody that they locate an urgent care center that is close to home so that they know what they're dealing with before they need it. Does that make sense?
I'll
Okay.
also add that that has happened also to me. So it was an urgent care clinic, and then I noticed I went back and they just had some new doors. So the doors were just sliding doors like this, and it said emergent care. So now it wasn't urgent care anymore. So I ended up paying like 200 and something bucks out of pocket. So the best thing to do is exactly what Jim said. Know what urgent care clinics are in your area and just say, I'm going here. Like, because if you're just on the fly looking, those ones will really trip you up. The first question I always ask to, so the way that I found out is when I paid my copay. But what I learned is when you walk in.
What's the audio?
So when you walk into the place, simply ask them, is this an emergency room or is this an urgent care clinic? If you're not sure it's an emergency, you're just running in somewhere, ask them first before you give them your card.
The other thing is there are some in-network, I think, ready clinics, which are located in some of the pharmacies. You know, there are other places that you can get kind of urgent care with extended hours. But the best place is to just identify down in our part of the country, Texas Med Clinics are one of those for urgent care services. So that pretty well concludes just the high overview of the medical. Do any of you have any questions about that? A couple of things, I guess, that I need to follow up on is having to do with the reset of the out-of-pocket and the deductible. Those are on a calendar year basis. And so the health reimbursement account also runs on a calendar year basis. What that means is that if you have satisfied your out-of-pocket already for the year, and you have expenses during November and December, even though we're in a new plan year, you still have satisfied your deductible and out-of-pocket for the year, okay? That resets on January 1, so that can get a little bit confusing, but all of those are per calendar year plans. So we good? Want to talk about dental? Okay, all right. Dental plan is moving to United Concordia. We had a pretty big rate increase on the prior plan, so we went to market, looked at a lot of different plans and decided that this one was the best replacement, very much like the one you had in the past, or you have right now actually, with one exception, and that's we're adding a rollover benefit. But this plan, like your old one, has a $2,000 annual maximum, so it's per person in the family covered. So if you have 5 people covered in your family, then you've got 5 $2,000 maximums that you have available under it. There is a $2,000 lifetime maximum on the orthodontia. The orthodontia covers children and adults, but it is a once-in-a-lifetime benefit, not an annual benefit. Cleanings, preventative care covered at 100%, no deductible. The extractions, fillings, root canals, those are covered at 80%. Bridges, things like that are covered at 50%. The basic and the major services do have a $50 calendar year deductible, okay? Once again, since we're changing November 1, if you satisfied your deductible with the prior carrier, all we have to do is evidence that to the new carrier, and you don't have to satisfy it again for the rest of the year, but then it does start over again on January 1st. The new piece of this, which is an advantage, is it has a rollover benefit. This is a benefit that allows you to increase your maximum year by year. So instead of $2,000, It'll be $2,300 next year, $2,600 the following, $2,900, so on, up to a max of $3,200. The way you do that is you have to go see the dentist at least once during the year and not spend more than $1,000. So let's say you went to get an annual checkup, and let's say the total cost is a couple $100. Well, then you're in the next year, you've got $2,300 as your maximum benefit under the plan. And so just keep that in mind. At least go to the dentist once a year, do an annual checkup, and then you'll grow your benefit under this program. And there are a lot of these dental plans that are like that. So if 2 or 3 years from now, we find that there's one that's more competitively priced and we decide it makes sense to move to it, we can roll the benefit that you've accrued under this program over into the new program, okay? So any question on the dental program? You can go in or out of network. We've discovered that the provider list with United Concordia is actually a little bit bigger than the one you have now, so there will be some of the dentists that will be in network that haven't been. If you go out of network, the benefits are the same. They don't change. It's just that out-of-network dentists are going to charge more than in-network dentists, and so your piece of it is going to wind up being a bigger dollar amount than if you go to an in-network dentist. Okay, so moving along, pricing on it. Is that any different than it is now?
No.
Same premium as you're currently paying.
By changing the provider, we were able to keep the premiums exactly the same, and that's how we did that.
And just so you know, these are great deals. I mean, the total premium is probably close to $30 a month for single and probably $90 a month for a family. So APA is really paying lion's share of the cost of these programs for you. Okay, vision plan did not change. Same carrier, same benefits, same rates, same everything. It does renew on November 1 as well. It's got a $10 copay for checkups. It's got $15 for lenses and frames, or you can have a contact lens. You can't have both glasses and contact lens under this program. You have to pick one or the other. There are out-of-network benefits. We don't have them displayed here, but if you go to an out-of-network provider, they'll reimburse you for your checkup. They'll reimburse you a certain amount for your frames and a certain amount for your lenses. And the cost on this program, if you're single, is about maybe $80 a year. You will receive more in reimbursements than you will in payments. So, it's a good deal if you need glasses, I think, to have this. I might mention a couple of things about vision plans. They're designed to fix reading problems or just regular vision problems, farsightedness, nearsightedness, whatever. They're not designed to treat illnesses or injuries. If you have a detached retina or a glaucoma or some other problem with your eye, that's a medical condition that your health plan will cover. So you don't have to have a vision plan to cover that. Blue Cross has an office visit copay for a checkup for your eyes, but you have to go to an ophthalmologist, which would be an MD, and not an optometrist, which is generally what you find when you go to Lens Crafters or Walmart or Target or something like that. So the vision plan will cover both. The medical plan will only cover an ophthalmologist. And there's no benefit for the frames or the lenses if you're using your Blue Cross plan. You would have to have the vision plan to cover that. Okay.
We have a question?
Yes.
Jennifer?
Okay, so this maybe covers a certain percentage of frames out of network. Is there a coverage for frames versus for just frames after?
We can't hear the question.
I'm sorry, but I'll repeat it. Just what was the question?
After you use your retail allowance, is there like a percentage coverage that they'll do on frames that you got 2 pairs, you use $150?
Okay.
One pair will get covered
Okay.
20%.
So the question is, if you use the plan and you decide that you're going to buy, let's say, 2 pair of glasses rather than 1, or let's say you're going to upgrade the frames to some designer class, or you're getting lenses that have tinting on them, or they're progressive or something like that, all of which is going to exceed what the allowance is. What happens is, yes, there's some discounting on that. Yeah, sure is. Good question. Anybody else? Okay, moving along here. We're going to get into the life insurance piece of our presentation. Yes.
Before we start, I'd just like to say that there are some upgrades to this plan. APA enhanced this benefit this year, so just listen out for that and we can talk about it at the end.
Yep. Okay, so this is a benefit that is paid for by APA in its entirety, and what Delia was talking about is that the benefit itself is going to increase, and again, this is November 1st when it will happen, from being a benefit that is 1 time your annual earnings to 1.5 times your annual earnings. So if you make $40,000 a year today, that's how much life insurance you have. But starting November 1st, that'll bump up to $60,000 because it'll be 1.5 times what your annual earnings are. And so that's a nice enhancement. The benefit remains the same until age 70, and then there is a 35% reduction at that point. It is portable, it's convertible, and again, it is paid for in its entirety by APA. There is a accidental death benefit associated with it, which means if you get run over on I-10, that your family gets twice what they would have otherwise. And then there's also a benefit for a loss of an eye, loss of a hand or a foot or something like that. So those are also included in the program. So this base plan, as I said, will start effective. The increase will be effective on November 1st. One of the things we're going to ask you to do is everybody's going to have to re-enroll for the benefits for next year. And one of the reasons that we do that is to make sure that everybody looks at and confirms their beneficiary designations, because things happen in life that would cause a beneficiary designation to change. And so by reminding you of that, by making you go through this whole process, then we will capture those changes, we think. Because if something happens to you, what happens is the insurance company relies on the data and the beneficiary designation that you have here at APA. Okay, so if the basic plan is not enough coverage for you to be comfortable, there's also a voluntary benefit that's available. You can purchase up to 5 times your annual earnings in increments of $10,000. So again, back to this $40,000 example, 5 times that would be $200,000. You can buy up to that. You can buy less than that, but that's the max you can buy under the voluntary program. You can cover your spouse for the same amount that you buy on yourself or less. You can cover children up to $10,000, and children are covered until age 26. As a matter of fact, all of these plans, for the most part, cover children until, well, I think it's 25 on this life plan. But on the other plans, the vision, the dental, and the medical, kids are covered to age 26, even if they are not in school, even if they're married, you can still cover them under your health plan or your dental plan. Okay, so if this is the first time that you are eligible for this additional coverage, so you're a relatively new hire, then there is 100,000 of it that would be available to you on a guarantee issue basis, meaning you cannot be turned down for it, okay? If you opt not to purchase it the first time you're eligible for it, and then you decide to buy it later, then you have to fill out an evidence of insurability form, which Delia will have available for anybody who has an interest. And you have to answer these medical questions, and the insurance company looks at those, and they can turn you down if you've got a significant medical issue, okay? So E of I is going to be part of what the process is in determining whether you're eligible for that coverage. But again, if you're brand new, first time to enroll, then you can get up to 100,000, no questions asked. And then the spouse can get up to 25,000, and of course the kids can be covered up to 10. The pricing on this coverage depends on your age, and so looking at this grid below, can y'all read that out here? Is that big enough to read? Okay. You know, taking the example of a 35-year-old that wants to have 100,000 of coverage, spouse 25, children 10, what you would do is you'd look under the column that's 35 to 39, and you would see that the employee rate is 6.4 cents per thousand, and the spouse rate is 0.083 cents per thousand. And so you would take 100 times the 0.064, which is $6.40. and then 25 times the 0.083 is 208, and then 10,000 for the kids is $1.87. So for about, $11 or so a pay period, that individual could have that amount of life insurance for his family or her family. As that person gets older, the rate does go up. So when they move into that 40 to 44 bracket, the rates would go as indicated there. It'd be at 8 cents, 13 cents, and then at 45, it's 12 and 20, and so on. So the rates get higher as you get older, but the plan is portable, so you can take it with you if you leave APA, and the rates you see right here would be the rates you would pay as you got older if you kept that plan. Okay? Question on that? Everybody good? Okay, good deal. All right, next page we're going to talk about are disability products. And
There's some changes to this plan as well this year, so listen up.
Yep. We had a confusing plan for HR and accounting last year, so we're trying to simplify it, make life better for everybody, for all of us actually.
Yeah, let's do it.
Yeah. We had kind of a base and a buy-up last year. This year we're just going to do the buy-up, okay, because there kind of was a duplication of some of the benefits. So what's going to happen is if you decided to buy more benefit on the short-term disability last year, then you can keep that, and whatever you're paying today, you'll continue to pay in the future. But the way this works is the disability plan is designed to provide you with 60% of your income beginning the second week if you're off because of an illness or an injury, a non-occupational injury. So it'd have to be something that happened away from work. You're covered by workers' comp if you're injured on the job, okay? So beginning that 8th day, if you're still off because of an illness, then you would be entitled to a benefit. And it will pay for as long as you're disabled, and this is determined by physician, making that determination. And it will cover you for up to 12 weeks, which is about 3 months. Because these benefits are paid for by you on an after-tax basis, that check you get from the insurance company is going to be tax-free, okay? So you don't have to pay any income tax on it, all right? There is a pre-existing condition limitation on the policy, and the way it works is this. Let's say for the first time you're buying this coverage, and it's effective November 1st. Sometime in October or September or August, you were treated for something. Let's say it was a heart condition. During that first year under the plan, so November 1 of 17 through November 1 of 18, if you became disabled because of that heart condition, insurance company is not going to pay, okay? But if you were injured in a car wreck, they will, because it's unrelated to what you were diagnosed for in that 90 days prior to the effective date, okay? If over a year from now you were disabled for that condition, you would also be covered because you spent that 1 year that they have that exclusion, okay? Those of you that have been covered for a year, you don't have to worry about this. This does not start over every year. It's just for somebody that's a new participant. Everybody understand how that works? Makes sense? Yes, ma'am. No, that's all right. Thank you for asking.
Any questions?
So it's for pre-existing condition past that year, it doesn't matter what continue to be treated for once you're past that year.
Exactly. Let's say you're diagnosed as a diabetic, okay? So you can't ever stop being treated for that. But at the end of a year, you're covered for that condition. Yeah. Okay. So that's the short-term disability. And then after that, if you continue to be disabled, then you move into what is long-term disability. But I guess before we go to that, let's talk about cost. It's complicated. So I told them earlier this morning, I did a little cheat sheet here so I can tell you as an example how this works. Let's say that you have a $50,000 income. You divide that by 52 to get what your weekly benefit is. And then you multiply that by 60.60 to get what the benefit actually turns out to be. And it's about $576 a week, okay? Then you take that $576 a week, you divide it by 10 because the rate is based on per $10 of benefit. And so then you do the math on that, and it's about $9.52 per paycheck for somebody who makes $50,000 a year. So if you make $40,000 a year, then you'd take 80% of that, be about $720 or $730 or something like that. If you made $100,000 a year, you'd double that. Does that make sense? Okay, so just to give you a kind of a flavor for what the premium is, it's really pretty reasonable, I think, considering that it starts to pay beginning the 8th day. Now, if you have strep throat and you miss 2 or 3 days of work, it's not going to do you any good. But if you get pregnant, you're off 6 or 8 weeks, it pays for pregnancy. I use the example of somebody playing church league softball over the weekend and they tear up a knee and they're out 6 weeks. That's what this plan is really all about. So good program. I highly recommend you look closely at that. But if the disability goes longer than that 12-week period, and not many of them do, but there are occasions when it does, then we have a long-term disability benefit that will actually cover you as long as your disability lasts out to age 65 or normal Social Security retirement age. And for most of us, that's going to be after age 65. For most of you probably in this room, it's 67-ish or so, okay? So as long as the doctor can certify that you have a condition that keeps you from performing the normal duties of your regular occupation, well, then you're entitled to benefit. And the benefit is 66 2/3% of your income. It's higher than the short-term disability, but it is higher because, or at least one of the reasons is, the benefit, since it's paid for by APA, is going to be income taxable to you. So there is going to be some tax that you would have to deal with. Okay? Questions on that? All right.
Question about the new short-term plan and how that's different or how it would affect you? No? Okay.
Okay, so the next part of the presentation is going to be handled by Stephen Oliveris, one of my associates, and it's going to be the supplemental benefits that are provided through AFLAC. So Stephen, I'm going to let you take over.
Okay, thank you, Jim. And we're going to pick up right here into the AFLAC piece. I'm not funny yet, am I? Oh, all right. You're going to see, we implemented AFLAC last year. Went back to AFLAC, talked about the offer, what was made available to you all. One of the nice things is they went ahead and they pushed the reset button. What that means is they like you all, they like the participation, and what they're going to do is give you another run at adding some of these products without having to answer any health questions. So that's a good thing. It's a strong offer in my mind. Whenever we can have them do that, not having to answer health questions means everybody can gain the coverage. It's a guarantee issue. That's not a feature that we get to pass along each year. So good news on the AFLAC front there. The first plan I'll talk about is the accident plan. The accident plan that's set up here is designed to cover for any type of injury that you may have 24 hours a day. So if you get hurt at home, at work, at play, whatever you're doing, any type of injury that you have, so long as you seek treatment within 3 days, that's where they're talking about 72 hours, there's going to be benefits on this plan that are going to get paid directly to you. Okay, so I give a couple examples of how this works and really kind of tie into the rest of these benefits and how they fit in. So we have plenty of examples of our clients who get injured, they're out of work, so both their medical plans being utilized, their disability plans being utilized, and of course these AFLAC benefits as well. All of this is coming back into your pockets. That's going to help, offset your out-of-pocket expenses. So I'll give you a couple examples of how this works and how knowing where to go really does make a big impact on your out-of-pocket expense. So I gave the example earlier of it was 2 employees. They work for the same company. Employee A called me up, let me know that he had fallen off a ladder. He went to brace his fall and he broke his arm. He was at home. He was doing some yard work. Fell off a ladder, broke his arm, and I said, yeah, you have your accident policy. Let's go about, doing your claim. And he told me he went to urgent care. He paid a small copay there. He went to an orthopedic specialist with a broken bone. He paid, another specialty copay plus a little bit more towards his deductible. In total, he spent a little bit over $450 out of pocket for that broken bone. We went ahead, we put the claim in through AFLAC. This accident plan, the same design you all have here, ended up yielding about a $1,300 benefit that was sent directly to him. Okay, so at that point, that's when somebody calls and they say, hey, well, I only spent about $5. You guys sent me $13. What do I do with the rest? And I'll remind you that you can send some to me because we're pals. No, it's up to you to do with what you need to. So you apply those funds however you see fit. Okay. A couple of weeks later, same company it ended up being a different employee, threw me for a loop. The guy said, "Hey, Steve," it was on my voicemail. "I fell off the back of my truck. I went to brace my fall. I broke my arm." And so when I called back, I thought, "Yeah, we did this, didn't we?" He goes, "No." He said, "There's a coworker of mine. He saw me walk in with my cast. I told him what happened. He said, you got to call, that guy to see if you have the accident plan. It'll pay you for the broken bone." So he ended up calling me up. Same thing, same broken bone. They even broke the same part of their forearm. So the difference was the second employee, I asked him, where he went. He ended up going to an emergency room. So the difference was his out-of-pocket expense. It cost him $1,100 to get that broken arm fixed. So versus the $450 by staying outside of the emergency room, the second guy paid over double by going to the emergency room. So the dollars were the same. The Aflac amounts were, the same. They went to him too. Still made a little bit of money off of it, but the dollars go further if you utilize your healthcare the right way also. So definitely just kind of keep that in mind. They all kind of work in tune. And then I always recommend, if you have children, definitely put them on this accident plan. They end up becoming little money makers. I have a 5-year-old son who's on the payroll at the house. I have an accident policy. I've had it in place for over 14 years. I've used it a handful of times for myself. Broken bones, cuts that need stitches, minor things, thank goodness. My son is 5 years old. We get to make a claim every year on our accident plan now, whether he's fallen down, he broke his arm a couple of years ago. Just this last February, he fell off his bike. He wears a helmet, but the way he fell off his bike, he hit chin first. So the helmet went flying and scratched up his whole face. When I got home, I looked at him and I said, let me take him to just get checked out. And so just going into urgent care is a small copay, but the plan's going to reimburse me. They ended up paying me $155 just for walking in there and getting him treated. So make a little bit of money. Yes, we high five. We go on to the next accident. But the main thing is it just gives me the peace of mind. I don't have to second guess myself. Should I take him? Should I not? I know that I have this plan. And when he's about to jump off of something, it doesn't really, I don't run to him. I just kind of see how bad it's going to get. And so just keep that in mind. The accident plan on this policy actually has a wellness benefit that's embedded. So if you already have the accident plan, as you can see here, you have to be on the plan for 12 months in order for this wellness benefit to get triggered. So some of you that are already on the plan, that's going to trigger for you come November. Any annual physical, eye exam, dental exam, annual well woman exam, that's going to yield a $25 benefit. It's for one person on the plan each year. So even if you have a family coverage, 4 people, 5 people on the plan, this is looking to pay just one person per year. So that's the wellness component on this accident piece. Also included on the plan is accidental death. It's $40,000 for the employee, $20,000 for spouse, $5,000 for children. Typically don't like to recommend or really present too much about this, but it is a benefit that we're seeing more and more people, they're having to use. We had a couple of bad accidents in the San Antonio area that yielded this type of benefit for some of our clients just in the last few weeks. So definitely this is on top of any other benefit that you have, which is great. It's a good add-in. So that's already built into the plan. You don't pay anything extra for that portion, which is nice. So just keep that in mind. The next plan that I'll scroll down to is the hospital policy. The hospital policy is paying for hospital admission. You're admitted into the hospital for 24 hours. It's going to be a $1,000 benefit. Now, I'll say this a little like a PSA, because what we've noticed is some of the hospitals nowadays, even though you're there, you're in a hospital room, you think that you're inpatient. When you get out and you turn in your paperwork to make these claims, we're noticing that some of the hospitals are still coding these as observation rooms. And we're finding a little bit of a hardship making that claim. So it's pause for concern for sure. But if you're looking at this plan because you know that you're going to have, added the family in the future, then definitely it's a safe bet. That hospitalization for those days that you're in the hospital or your spouse is in the hospital, definitely is going to yield a $1,000 benefit for day one. And then, of course, $150 for each day that you're in the hospital after that. If somebody's admitted to ICU, $150 for 10 days of ICU stay, in addition to the daily benefit, so a $300 benefit for ICU for 10 days. So just keep that in mind. This policy also pays for, it says here, admission to the hospital for injury or accident. It also pays for illness, so just know that as well. It's kind of being specific when it's saying, you know, if it's an accident, it's going to be once a year. So just kind of keep that in mind. The health screening benefit that you see there, again, it's a $50 benefit. This is available to you and spouse on the plan. Any one of those health screenings is going to yield a $50 benefit. This is available every year. It's once per calendar year. So for you and your spouse, once a calendar year, that's a $100 benefit. If you're already on the plan, make sure that you make this claim, and definitely you can contact our office in order to get that claims process started. So that's the wellness benefit on that plan there. On the next page, you're going to see critical illness. The critical illness policy, the way I like, what I like about this design is it encompasses cancer diagnosis, heart attack, sudden cardiac arrest, having a stroke, kidney failure, end-stage renal failure. Each of those events, it's paid out at 100% of the amount that you elect. And on this plan, you can elect anywhere from $5,000, $10,000, $15,000, $20,000 in coverage. Again, that's your amount. Aflac's going to pay directly to you in the event that you have one of these events cap off. And so what we've noticed here, and from my clients, what I've learned is these benefits, they go towards more than just your out-of-pocket expense. So here you're kind of lucky. You have the HRA, which does help tremendously, but then also you still have, you know, the time off from work. You have 60% of your salary that you can cover, which is great. But where does the other 40% come from? So a plan like this can help offset, you know, that out-of-pocket and that lost income. I have a client in particular that I talk about in December of 2016. She was diagnosed with internal cancer. She chose MD Anderson down the road for her treatment. And so to hear it from her, I spoke to her a couple of months ago. She goes once every 3 weeks. Her and her husband, they leave on a Thursday night. They miss a Friday's, you know, work day. They're at the hospital. They stay at a hotel nearby Thursday night, Friday night, sometimes Saturday night until they're ready to come back. So what she's telling me is the benefits that she received from this plan, her $20,000 amount is gone in front of having to go into her, you know, savings account or touch a 401k. She doesn't have to have her hand out for going through this type of an event. So the policy's strong. That $20,000 or any amount up to $20,000 is guarantee issue, meaning you don't have to answer the health questions, which does mean everybody can get the plan. This plan also does have a $50 wellness benefit again. So that same screening benefit's available to you. This is available to you and spouse again for, you know, mammogram, pap smear, colonoscopy, chest x-ray. So just kind of keep that in mind. You do have that benefit built in as well. The one thing I'll point out about the rates for the critical illness plan is they're segregated by the age bracket, 18 to 29, 30 to 39, so on and so forth. So whatever age bracket that you're in when you enroll, you lock into that bracket for the life of the plan. So as you get older, you don't have to worry about paying more for the plan. That's a nice feature. Okay, keep that in mind. On this plan, your children are covered automatically at no cost. They get 50% of the amount that you take. Okay, it's the only plan that you don't have to pay for the kiddos to be on. And definitely they're covered to the age of 26 on any of the plans. So just keep that in mind. If you wanted to get the policy for your spouse, the spouse is limited to 50% of the amount that you take at your spouse's age. Okay, so if you married somebody younger than you, then good job. Save some money there. So keep that in mind. But one of the things that you're going to notice when you go into your portal for enrollment, if you're already on the critical illness plan and you were in the 18 to 29 bracket last year and this year you're going to be in the 30 to 39, the program, the software can't freeze the rate. So you're going to see a higher rate for critical illness. Please go ahead and make your election. If you've already had the plan and you want to keep it at that rate, make that election. After the enrollment's done, we're going to do our audit and we're going to roll back, you know, that amount so that way your deduction stays the same. So just keep that in mind. It's just something that the system cannot do, but we'll go back and we'll roll back the rate on you for sure. So just know that. Are there any questions on how these three plans are designed? Yes, ma'am.
I have a question regarding the rates. Is that per pay period that's listed there, or is that the monthly?
Her question was about the rates on page 13. These are listed as per pay period. Yes, ma'am. Okay.
All right.
All right.
No questions here?
No questions. I'm going to turn it back over to Jim. He's going to drive the rest of the way, starting on page 14.
We're about ready to wrap up. Just to be sure, those that are leaving, you do have to re-enroll in every benefit because everything terms at the end of October. So if you don't re-enroll, then, okay. Okay, good, I understand. Okay, so that really ends the insurance piece of it. Where there are some additional benefits that we want to just point out to you real quickly. So the next page talks about the EAP program. This means Employee Assistance Plan. This is a new benefit in which you have a resource to go to 24/7 if there are issues in your life where you really need somebody to talk to. And it can be a legal issue, it could be a work-life issue, it could be a marital problem, it could be incorrigible teenagers you need some advice on, substance abuse, any number of different things. The professionals that answer the phone are, they're trained in these areas of life issues, life problems. So they're there to help you. There's no reporting back to APA about the call. Anybody in your family is entitled to use it. There's no personal identification on any of it, so there's no way anybody knows, what it's all about. They also have the ability to refer you to up to 6 face-to-face meetings with somebody on a local basis, that if you need, some more intense counseling, you can get that. And again, it's no cost to you, no reporting back to anybody, so it's perfectly confidential. So be aware that that is a new benefit that has been added. There is also one other one, which is kind of interesting, and it's called Safe Ride. So those of you that have a little bit too much to drink at Fiesta can call this for a free cab fare back home. And I think Eliza said you're entitled to 1 before they start asking questions. And then three or more, they may refer you to a counselor. So anyway, just be aware of that. Okay.
You can call me.
All right, yeah, or you can call a friend.
Call
There
a
you
friend, yeah.
There you go.
Not HR.
Okay, so that's EAP. The flexible spending account is an account which allows you to put some funds away each month on a pre-tax basis to help you pay for uninsured medical expenses. So that would be that $1,000 deductible and out-of-pocket we talked about, some of the co-pays, you could cover dental. Let's say you cover yourself for dental, but not your dependent. The dependent decides to get some dental work done. Well, then you can cover that with your HSA program. So the main thing it does is it converts your payment to some provider for healthcare expenses from a after-tax to a pre-tax payment. Okay, the most you can put into it is about $2,600 a year. There is the lose it or use it proviso that you need to be aware of. What this says is that whatever you put in that account, you need to spend on uninsured medical expenses, because you can only carry over $500 to the next year. So if you put in $2,000 and you only spent $1,000, you would forfeit $500 under this program. So be pretty conservative in the amount you put in. And kind of look at what your history has been in terms of your spending, and then kind of go from there. So the other part of it is a dependent care benefit. Dependent care works the same way. You can put up to $5,000 a year into a dependent care flexible spending account, and then you can pay your dependent care with it, and you convert it from perhaps after-tax to pre-tax dollars being spent for that benefit. So that's something you may want to consider as well. The FSA, there's an example of it down there, which I didn't go through today, but this particular case, there's $30,000 of taxable income. They show the taxes, it would be around $2,500, and FICA, another $2,200. So net after tax is $25,000. And you had out-of-pocket expenses of $5,300. Leaving you with $19,000 spendable income. If you took that $5,300 and paid for it pre-tax, then it would reduce your tax liability quite a bit and actually free up about $1,200 of spendable income. I don't know how real that example is, but basically it just shows you the impact of paying for those expenses pre-tax as opposed to paying for them after tax. Okay, so the FSA is one benefit that you have, and yep, that's a 1-1, isn't it?
Yeah, I'd like to interject that this plan, the FSA, the dependent care, the transit, those are all going to be effective on January the 1st. So we're going to have a different open enrollment meeting for those benefits at the end of November, early December-ish. So right now we're just kind of going over this high level, but we will have a different open enrollment meeting for this. And also we'll have a different education meeting on the EAP probably next month. So just to let you guys know.
Okay. Yep, just trying to hit these at a high level to make you aware that they're there, and so you don't forget about them. The transit account is the next thing that we were going to talk about. If you do take mass transit, you're entitled to a reimbursement up to $255 for the benefit. Probably not highly utilized in San Antonio, probably more so in New York, Washington, maybe in that area. Okay. And then there's some important notices that we're required to give you. And so you can look at those when you get a chance. And then there is some information about Medicaid and CHIPS, which is the Children's Health Insurance Plan, which is a means-tested health plan that might be available to you depending, again, on your income levels. But there's information about that and contact information if you think you might qualify for that. The Medicaid, probably not anybody in this organization would qualify for. CHIPS, maybe. There might be some that might qualify for that. And then the final thing I'll share with you is just a page that has accumulated phone numbers and just remind you again, there's a lady in our office named Tina Berger. She's top of the list. That's her phone number and her email address. And it is her role to assist you in any way she can to find providers, to help you understand billings, to just be your advocate with the insurance company and also with your providers. So if you have something that comes up, feel free to give her a call and put her to the test. And then the rest of this is the carrier information about their nurse line, their customer service numbers, and things like that. I didn't mention the nurse line. I always forget that when I'm going through Blue Cross. Blue Cross has a 24/7 nurse line. You can call them anytime if you have some kind of a symptom and you're concerned about whether you can wait till tomorrow to go see the doctor, or whether there's something over the counter that you can take to treat it first, or if it's serious and you need to get to the ER right then, the nurse can help you kind of ferret through that and determine what to do. The other thing that I find them pretty valuable for is on interaction of medications. If you're taking an over-the-counter med and you're getting ready to take something, or excuse me, a prescription, and you're going to take an over-the-counter med, and you wonder about whether or not there's going to be a bad interaction with that, the nurses can tell you, so give them a call. There's no cost to it. Anybody in the family can use it. Okay, so that sort of concludes my part. Deya, you're going to talk about the enrollment process? Okay, so Deya's going to take it from here, and I'll hang a few minutes. If anybody has any questions and needs to talk to me afterwards, I'll be here for that. Thank you.
It's okay. You can give me the remote.
Yep, I can do that. Forgot about
All
that.
right, guys. So what I want to do now is I just want to take you really briefly through what you guys are going to see.
Do I need to hit this red one too?
What does it say?
Stop sharing.
Yeah. Okay.
That work?
Eileen. This is more for the remote people. Can you guys hear me? All right, good. Thanks, Kurt. Let me see if I could figure out how to make this happen here. Share screen. Okay. So what I'm going to do is I'm going to show you guys what it's going to look like in ADP when you get into the system. So in a few minutes, once we get back to our desks and figure out what we're going to say, Liza and I are going to send you an email. And the email is going to give you all the instructions on how to enroll. We'll attach these recordings of both of the meetings. And so this is what it's going to look like when you get into ADP. The first thing I'd like you guys to do before you even go in here is go print out your current benefits list, because as you go through here, you're not going to be able to see your current enrollments as you go through the steps. Okay, so that you can remember how much life insurance, or did I get that? I think I have it. Go ahead and print that out. Then come in here. And the first thing it's going to ask you to do is to review your beneficiaries and your dependents. So if you click here, you'll be able to add a dependent or a beneficiary, or both. If your beneficiary is a person or an organization, go ahead and add, edit, remove if you need to, anybody here. And then my next recommendation is going to be to click on walk me through my benefit options. If you do this one, you may miss a lot of things. And not just that, but because we have to go through every single benefit and re-enroll this on ADP, you may miss some. So if you go through walk me through, it's going to take you to every single one. So this is what it's going to look like when you go in. The first thing you're going to see here is a welcome message with some reminders. I know it's just more to read, but it's important. That's why we put it in here. So go through here. It has some details about when you're going to need to fill out any special forms outside of ADP. Then you can just click forward to medical. And if you, I'm going to remove this just so you can see. Yes. Okay, so this is what it's going to look like. And you say, I don't know, what's in there? Well, if you click here, you're going to see that here's a summary and the summary plan description and then the drug list that I told you all about. So that way, if you go home this weekend or tonight, you need to talk to your husband or your spouse, you can go ahead and click here. I'm not going to open it to PDF. It's going to make me all confused. But you can talk to your spouse and decide if this is what you guys want to do. There's also that drug list that we referred to here, and then all the contact numbers and the website links here, okay? So when you click enroll in this plan, you're going to see the following options. You're going to see the beneficiaries and dependents that you set up in the beginning. And if you want employee coverage, you see it removes everybody. Employee and spouse, my kids are gone. Employee and children, my husband's gone. And now all of us, and that's what I'm going to do. Okay, same thing. So we're going to continue. Now we're going to go to dental, and who needs dental, right? And then I'm going to go to vision. I'm already enrolled. Same thing. We have the little buttons here again, the descriptions for easy access there. And then the one that I really wanted to show you guys was this one on the voluntary life. And the reason is because it's a little more different than the other screens. You see right here, it has that little toggle back and forth. And so there's some hidden. And then you'll also notice right here, it says non-smoker and smoker rates. So if you click on the smoker rates and you're non-smoker, you're going to pay more for the same thing. So I'm going to go ahead and enroll in this plan. And I'm going to just, so I can show you guys what it looks like. So I'm going to just get 20 grand. And you see here, it's requiring you to add a beneficiary. So either you can say my husband is my primary beneficiary, and then should something happen to my husband, my children, I guess I'll let them share, will get 50% each. So this is really, really important for you to update this part today, okay, or as you're going through the benefit. Again, making sure that you're paying attention to the smoker, non-smoker. Remember also that if you enroll your children in the plan, that you can enroll all of your children. If you have more than one, it's the same cost. Short-term disability, again, same thing all the way through. You're going to just notice those shortcuts and all of that good stuff, the links there. So once you're done going through every single benefit, enrolling in them, at the end, there's going to be a button, and I don't know where it is on the live version of this, as this is a test version, but I think it's up here on the top where it says review and complete. So then at the end, let's go ahead and go through, review and complete. You're going to be able to see what you currently have, are going to enroll in, how much it's going to cost you every month. And then you notice here that I skipped dental, right? If you skip medical, dental, or vision, we need to know why. This is, we need to provide this information for our enrollments every year. So you're just going to click down here and say, you know what, I have it through my spouse. It's too expensive. Whatever the reason is, I'm on my parent plan, I have a different plan. Whatever it is, you'll just let us know, and then you'll complete your enrollment here. Once you complete your enrollment, HR will receive a notification, hey, Christine did her job and she completed her enrollment. Then we're going to go through and we're going to check Now, if there's anything that looks really, really odd to me, like Christine kicked her husband off the plan, and I'm like, that doesn't sound right to me. I'm gonna call Christine and I'm gonna ask her, hey, Christine, is this right? I just want to double check before I submit this. So she's gonna say, yeah, totally meant to do it. Okay, good, let's keep moving. So we may give you a call, or we may have some questions. Again, it's just to make sure that everything is perfect. We don't want any problems, or we want you guys to have the coverage that you need when the time comes. So that's what open enrollment's gonna look like in ADP. So if we do that, then hopefully we're not gonna have any reason to, you know, I'm looking over here just because it's odd looking at this blank. So just to let you guys know, if you guys have any forms, the only form that you should probably have to fill out is if you're increasing your life insurance above the guarantee issue amount, or if you're enrolling in insurance for the first time and you missed if you missed your main first opportunity to enroll, then you will need to complete an evidence of insurability form. I have some blank forms here, but the form is also on that little link, that little there's an evidence of insurability link to this form. You'll print it out, bring it up to HR, and we'll take care of it from there. If your increase is approved, you'll notice the change. When we receive notification that your increase is approved, you will notice the change begin on your paycheck. So do we have any final questions today before we close up? Yes, ma'am. Oh, great question. Open enrollment closes on the 13th. So that means you have today, when we get that email out to you guys, all weekend, and then all next week until Friday to complete this very simple step that took me 3 minutes on ADP. But again, we want to give you time to talk to your family and figure out whatever it is you have to figure out. So again, give us a call if you have any questions, shoot us an email. Oh, if you get any error messages as you're going through open enrollment, take a snip of that error message and send it to us so that we can investigate it on our side. So you don't need to call us, just the error message is going to be perfect. That'll give us everything we need to know from there, and we can call in our resources to help us out from there. Yes, ma'am. Yes. So all of your benefits are going to terminate at the end of this month. If you do
What was the question?
If you do not undergo open enrollment, then whatever you don't enroll in, you will have not have it anymore at the end of this month. You will have none. So you have to undergo open enrollment. So that's just a little reminder. I'm sorry, did I have a question? I didn't hear it.
Well, I just didn't hear what the question was.
Oh, the question was, it was more of a comment to remind you that if you don't enroll, then you won't have any benefits after October 31st.
Thank you.
Sure, no problem. Anything else? Yes, ma'am.
So just to clarify, so everyone has to do open enrollment, but you only have to do a form if you haven't already enrolled, or if you're changing your life insurance amount. Is that right? Okay.
Correct. Everybody will undergo open enrollment and only need to fill out the evidence of insurability form in those 2 instances that I mentioned. Thank you. Any other questions? No? Okay, so I'm going to go upstairs. We're going to work on an email to send out to you guys, and you will open up the portal system. You can start logging in as soon as this afternoon. So I hope you guys have a great rest of the day. Thank you so much for listening, and we'll talk to you soon.
Thank you.